I'm Dr. Girish Nelivigi. Today I'll be talking on testosterone. Testosterone is the male sex hormone which is responsible to maintain libido or the sex drive and also for normal erection in the male. It is also needed for the fertility functions. Many people come to me with decreased libido, with erectile dysfunction and fertility issues. In such people, we do serum testosterone levels or the estimation of testosterone in the blood to see if it is normal or abnormal. Sometimes we find that it is abnormal or low. Now, what are the causes of low testosterone levels? Low testosterone levels are primarily because of some problem in the testis. The testicles or the testis are responsible for production of the testosterone, and any damage to the testis or any chronic disease in the testis is responsible for low production of the testosterone. There could be some problems in the brain also which are responsible for the low production of testosterone. This is because there are centers in the brain which give signal to the testis to produce testosterone. So any problem in the brain, like there could be some congenital abnormalities or there could be some acquired abnormalities like some tumors, chronic infections, etc., in which the brain does not send sufficient signals to the testis to produce testosterone. So these are the two common causes why testosterone levels are low. Of course, there are other causes for those diseases wherein there is a problem with the receptors, where the testosterone is normal but it doesn't work because of problem with the receptors. But they are rare situations and we usually don't see them commonly in the clinical practice. Now, what to do once we find that testosterone is low? We find the cause. That's the most important thing. And we treat the cause if possible, and also replace testosterone so that it attains normal blood levels or serum levels. This is called testosterone replacement therapy or TRT. TRT can be done either by giving tablets or testosterone tablets to the patient or by giving injections. The tablets have to be taken every day on a long-term basis, and the injections are given in preference to tablets. The reason why we prefer injection to tablet is they are depot preparations, which means to say that we give those injections once in a few months. For example, we give them sometimes once in 2 months or 3 months because the serum levels are achieved for the next 3 months once an injection is given. Also, there are some oral preparations which pass into the blood and are metabolized in the liver. So some of them may have liver problems if consumed on a long-term basis. That's the reason why we prefer injectable testosterone as compared to oral testosterone preparations. Of course, testosterone replacement therapy can be done indirectly also without giving testosterone by giving some precursor hormone injections like HMG, HCG, etc., which are given as injections and which stimulate the body to increase the level of testosterone in the body. So they are given in different situations and for different purposes. So this is about testosterone decrease and testosterone replacement therapy for erectile dysfunction and other sexual disorders. Thank you.